The first question is, what skills have been most valuable in your career? And I'd like for our panelists to read between the lines, because these questions were submitted by our students who are interested in jobs, and take that question also as, what skills would they need to get into the career and be successful and advance in the career? So we'll start down at that end and then we'll start.
I think I'd like to build on what both my fellow panelists had to say, and since this is personal, what has been most valuable in my career, I think I'd like to start with approaching a problem, approaching people, approaching where you work by giving the other person the benefit of the doubt. Not starting from a defensive position, but looking, as Dorothy said, to come to yes. And I think that's very important. I've always said in my career that if I'm going to make a mistake, I'm going to make a mistake on the side of the other person. And regardless of what happens, an example of that, how it works out in the workplace, is when I was at Mercy Hospital of Philadelphia, and I was the chief financial officer, and this is a little bit long, but I think you'll get the point. There was a young girl who was brought into the emergency room with an asthma attack, and she was aphasia. And she, through loss of oxygen, had gone into a coma. This young girl was 14. And there was a choice. She could go to Children's Seashore House, which was a rehab facility, or she could go and be on a vent for the rest of her life. And the decision, as chief financial officer, you wouldn't think that, came to me. The nurses came to me because they thought that this young girl had potential. And they said, she won't get the kind of care if she just goes to a vet rehab. Can we find a way to send her to Children's Seashore House? So Children's Seashore House would take her if I guaranteed payment for this girl. And that's a big limb to go out on when you're in a big organization, to go ahead and do that. And I went ahead and I did it, and everything worked out. It turned out that young girl did make progress. She was never the same, of course, but she made enough progress to go home and live with her grandmother for the rest of her life. And that's where I think it's important for those of us in public health to always put the people we serve first. The second thing that has served me well is an ability to take a lot of different information from a lot of different disciplines and put them together in a plan. So I think that planning and having a plan and being able to plan is a critical skill. It's a critical life skill, and it's a critical skill for all of you as you move through your careers.